Healthcare costs are climbing, and changes to Affordable Care Act subsidies has left many families priced out of basic care. So free and low-cost clinics are really becoming more critical.
Right. In Katy, one faith-based clinic is quietly filling the gap for thousands of patients every year. Our Haley Hernandez has more.
On the surface, Katy looks like a place where most families have good jobs and good insurance. But behind the booming growth and new distribution centers, there are thousands of people who simply can't afford to see a doctor, especially as premiums, deductibles, and prescription costs keep going up.
The poverty looks different here than it does in inner city, but there's a huge need.
As healthcare costs and ACA premiums rise for many working families, places like Christ Clinic are becoming a financial lifeline. Here you can see a doctor for primary care, chronic diseases, even specialty care like cardiology, gynecology, physical therapy, and get lab work done for less than a tank of gas.
So we just ask those patients for a $20 contribution. If they don't have it, then we can waive it, but we really only waive about 10% of our contributions because most patients want to contribute to the cost of their care. And then we have another tier for patients that don't qualify. So if they make more than 200%, then they can pay $50 to come in and see a primary care doctor and get a low-cost prescription.
We're talking about healthcare costs that usually cost hundreds, sometimes thousands of dollars. So it is saving money. But Christ Clinic is also cognizant of saving patients time, which is a primary reason many avoid getting the care they need.
So every minute counts when you're an hourly worker. So our typical cycle time is 60 minutes. So it's like time in the door to out the door. So if we can get everything done that a patient needs, see the provider, give a diagnosis, write the prescription, get their labs drawn, let them get their prescription from the pharmacy and have them back at work, then that's a huge win for the community and the patient.
Despite rising healthcare costs, the clinic is able to operate because of generous donors, doctors, and nurses who work there entirely for free. I've got a list of all affordable healthcare options in our area. You can find one near you by going to click2houston.com. I'm Haley Hernandez, KPRC 2 News.